Hello, I am Dr. Harsha Reddy. I am consultant obstetrics and gynecology. I practice in Cloudnine Hospital, Sarjapur branch and the Bangalore branch in Bangalore. The bulge in the middle of the abdomen which happens after delivery in some women can be due to various reasons. One of the most common reasons is diastasis recti. This is due to the suppression of two muscles which are actually running vertically on either side of the midline called rectus abdominis muscle. This is the most common reason and this causes a bulge in the middle of the belly. Second reason could be due to hernias. If it is a large hernia, it has to be treated by surgery, whereas a smaller hernias will usually be monitored by your doctor. Third is due to hormonal changes which happen in pregnancies. These hormones are making your body store a lot of adipose tissue, simple words fat, as well as loosening up the connective tissue or weakening the connective tissues. So what is diastasis recti? Diastasis recti is a suppression of the rectus abdominis muscle. As I told you, it's the vertical muscles on either side of the midline. Normally, there is a distance of about 0.5 to 1 centimeter between these two muscles, the right side and the left side, that is 1 finger width. If this separation between the right muscle and the left muscle becomes more than 2 finger width, it is called as diastasis recti. Now, if diastasis recti has been identified in you, I would give two pieces of advice which is very important. One is don't ignore it and don't accept it also. Yes, it is a common problem, but it is not normal. You have to get in touch with your doctor and a physical therapist or a physiotherapist which we call and properly rehabilitate yourself. Second point is hold up on the crunches. Normally people have a tendency to do abdominal crunches thinking that that is going to help your abdominal muscles, but this abdominal crunches will neither help your diastasis recti and actually it is going to worsen it. So when do we see this diastasis recti? It's usually seen after the first pregnancy itself. More common in women who have had excess fluid or big babies who are having multiple pregnancies, that is twins. It's usually diagnosed in the third trimester of pregnancy or after delivery. The most common reasons why this diastasis recti usually happens is either because of excessive weight gain during pregnancy, poor posture, improper use of all the abdominal muscles and lack of strengthening exercises, which you didn't do proper strengthening exercises for the abdominal muscles. Why shouldn't you ignore or accept this diastasis recti? It is not just a cosmetic problem. It is going to give rise to other health and sexual problems. It is going to give rise to a lot of low backache. It could give rise to urinary incontinence, pelvic floor problems, pelvic floor disorders, as well as pelvic organ prolapse. So what is the treatment? You will usually be referred to a physical therapist or a physiotherapist. And the first thing is learning a good posture. How to maintain a good posture is very important. Your muscles have to be aligned well so that your breathing becomes easier. Once you have your control on your posture and your control on your breathing, doing your exercises in that controlled breathing manner as well as how do you lift your baby, all these will be taught by the physiotherapist. There are certain exercises which are specifically, you will be taught this for the diastasis recti, and these exercises is basically to strengthen the muscles which run horizontally along your abdomen, which we call as transverse abdominalis. So these exercises are your planks and bird eye exercises as well. So achieving and maintaining a healthy body weight before the pregnancy, during the pregnancy and after the pregnancy is very important, because this will help reduce the size of your abdomen over which your muscle has to stretch, and it also helps your muscle to tighten itself after delivery.